Ladies and gentlemen, I need your help with this COVID-19 situation, coronavirus. I was wondering, why are they not shutting down international travel? I was wondering that. But then I realized that this may actually cause more problems than just letting it spread, because I don't think that it can be stopped. I think it's going to continue to spread anyway. It may cause more problems to try and stop it, shutting down travel, closing the borders, etc. Now, also, I heard that this virus, correct me if I'm wrong, may have been spreading since November of last year, 2019. Now, here's what's really interesting. This is a personal story. My friend went to the hospital for flu-like symptoms, a cough and a fever. Now, keep in mind, we live in a very large city in the U.S., on the West Coast. And when my friend went to the hospital, they didn't run any tests. They just prescribed Tamiflu. Said, oh, you got the flu here, just take this, go home. Hopefully you get better. Now, I began to wonder, if they do this to every patient that goes into the hospital, do they not test them? Now, I wanted to know, was anybody being tested for this COVID-19? Or are they just being prescribed flu medication sent home? So I went straight to the CDC website to see how are these tests for the COVID-19 being conducted. And it seems as though the testing is possible at the CDC, and the CDC wanted to make the testing available for other locations. And on February 3rd this year, 2020, there was actually a quality control issue. So the CDC is remanufacturing the tests for distribution once the issue is addressed. The CDC continues to perform initial and confirmatory testing. So my question is, who is being tested for COVID-19? Well, on the CDC website, the question is asked, should I be testing all patients for COVID-19? Should I collect samples and have them sent in for testing? And their answer is, at this time, CDC only recommends diagnostic testing of patients who meet the clinical criteria for a COVID-19 persons under investigation, or a PUI. And that's per their interim guidelines for collecting, handling, and testing clinical specimens for persons under investigation, PUI. So at this time, PUIs, persons under investigation, are identified as individuals with a history of travel to China or close contact with a person confirmed to have COVID-19. Now, for more information about interpreting testing results, they say, see description, label, interpretation of a test result from CDC 2019 novel coronavirus. So how many people actually have been infected with COVID-19? That's a good question. Am I misunderstanding this information? Is it possible that way more people have COVID-19 than we realize? Now, you think if this report's true from November of 2019 has been spreading, they're not testing random people. Is it possible that we have no clue because they are only testing people who are under investigation, PUIs? Now, you may have heard of this report of a person in the U.S. here who recently has been infected with COVID-19, and it was not a person under investigation. So how did he get tested? It seems as though this person must have demanded to be tested. He wasn't under investigation. The report is he didn't know anybody who went to China, traveling abroad, etc. He's still confirmed to have COVID-19. How did he get the test? That's what I want to know. Am I misunderstanding this information? If anybody can please shed some light on this, would be really helpful. Also, if you could please let me know if I'm mistaken in that we have no clue how many people have the virus or who've had the virus. Have I had the virus? Have you had the virus? And my friend, like I said, assumed he had the flu. Lived in a very large city. International travel through here every day. We simply are not testing, as far as I understand, people who are not under investigation, persons under investigation. And if so, why are they not testing people? Is it because there's no way to test people at this time, everyone who says they have the symptoms? It's just impossible to do. It would be so many people, not enough ways to test it, etc. Is this the case? Let me know. And I hope you have a great day.